Assalamualaikum warahmatullahi wabarakatuh. To our lecturer, Madam Maisara binti Muhammad Saleh. My name is Muhammad Alif Daniel bin Jamil Hasmadi. I'm from SR 113-4B. Today, our group will present about obesity population. So, before we start our presentation, I would like to introduce my groupmate, which is Ahmad Daniel Safuddin bin Muhammad Dinai, Ainur Shanifa binti Johari, Nurin Akila binti Mazlan, and Nur Ashikin binti Harun. For our presentation, we have 7 content for this slide, which is introduction, exercise purpose, physical and functional concern consideration, physical and emotion consideration, exercise recommendation based on FIT principle, 3 weeks exercise program for obesity population, and lastly, conclusion. Okay, for the first slide, which is introduction, I will explain to you what is obesity. So, the definition of obesity varies depending on what one reads. Obesity means having excess body fat. In general, overweight and obesity indicate a weight greater than what is healthy. Adults who is 35 years old and older with a BMI greater than 30 are categorized as obese. So, second one is factors that lead to obesity. So, first one in genetic. Genetic, the person who have genes that make it difficult for them to lose weight. Second one is environment. For those who live in a neighborhood with a limited healthy foods option or with many high calorie food option like fast food restaurant. So it is hard to someone to having a healthy diet plan if they stay in that kind of environment. The third one is psychological. So psychological means that depression can sometimes lead to weight gain, as some people may turn to food for emotional comfort. And lastly is medication, such as steroids or birth control pills can also raise risk for weight gain. Third one is the causes of the obesity. So for the causes of obesity, it can comes from many aspects. The first one is genetic, which can affect how your body processes foods into energy and how fat is stored. Second one is growing older, which can lead to less muscle mass and a slower metabolic rate, make it easier to gain weight. Third one is not having sleeping enough, which can lead to hormonal changes that make you feel hungrier and crave certain high calorie of foods. And lastly is pregnancy, as weight gain during pregnancy may be difficult to lose and might eventually lead to obesity. And lastly, of course, the obesity is a chronic disease. So these are the types of the disease that can occur if we have obesity. First one is type 2 diabetes. Second one is heart disease. Third one is high blood pressure. And lastly is cancer. For example, like breast cancer, colon cancer, and endometrial cancer. So for the next slide, I will pass to my friend Nurin Akila to explain for the next slide.
Hi, Assalamualaikum. My name is Nurin Akila binti Mazlan and I am from SR013-4B. So, today I will present about the exercise purpose of obese population. There are 4 exercise purpose, and for the first point is it will increase total energy expenditure. Energy is a measure in calories, and total energy expenditure is the number of calories that you can burn for each day. Okay, for the next point is decrease fat around waist and total body fat. It is a fast assessment of fat distribution that can reveal information about a person's overall health. People who bear more weight around their middle than their hips may be more susceptible to some health problems. Alright, we move for the third point. It is decreased chances to get the cardiovascular disease. It is because when you are too fat or the percentage of the bad fat or what we call low density lipoprotein LDL is high, the chances you to get a cardiovascular disease such as heart attack, hypertension and also diabetes is also increased. Now we move to the last one. The last one is improve the respiratory system. I'm saying this because obesity induces diaphragm, lung and chest cavity mechanical compression, which can lead to restrictive pulmonary injury. Excess fat also lowers overall respiratory system compliance, raises pulmonary resistance and lowers the respiratory muscle efficiency. Okay, now I will pass the presentation to my friend.
Thank you for the presenter just now. So right now my name is Ainu Shanifa binti Johari. So I will present to you the physical and function constant consideration for the obesity populations. So there are 4 points that I will point out in this subtopic, which is limited movement, fatigue, asthma, and pain in joint. This is the things that normally happen to the obesity populations. So the first point, which is limited movement. Those who are obesity and overweight, they are having difficult to do the some activities in their daily life. This is because their body shape and the body weight that they are carried. So those who are obesity, they are limit to do movement like jumping. They also cannot do the extreme activity just like normal people do in their life. For instance, when the obesity people want to do some exercise, just give like example of the sit-up exercise. Okay, in this case, the obesity people are having difficult to get up from the laying during the sit-up exercise. For obesity, they need assistance to help them get up from the lying down in the sit-up exercise because they are having a lot of fat in their abdomen, and that's make them difficult to get up. So for the suggestion, obesity people can do activities to make sure they are and stay fit by doing the water aerobic. Water aerobic is an exercise that gives a lot of benefit for those who are obesity. So basically, for those who are obesity, they can do water aerobic exercise because when we in the water helps to mix and support our body to make our body more lighter. So it is suitable for those who are obesity to do some exercise to make sure they are healthy. So move to the next point, which is the fatigue. People who those are obesity, they are easily to get fatigue during activity. So what is fatigue? Fatigue is a feeling tiredness or weakness that can be happen for physically or mentally. Obesity people are easily to get fatigue when they do the exercise. This population are easily to get tired as they make their body weight as the burden for them. When they do the exercise, they also need to breathing fast because they use a lot of energy. The obesity people normally use the energy divided into two, which is to do the exercise and to carry their weight. This is make them easily to get tired. So if we want to do training program for the obesity people, we must concern about their fatigue consideration for the obesity people by create a training program using the FITT principle, FIT principle. If we are ignore the physical concern consideration, which is fatigue, they might be injured when they do the exercise. Okay, move to the other perspective, which is asthma. The obesity population are commonly exposed to the asthma because their breathing range are different than the normal people do. They are having difficult to breathing because the excess of their weight around their chest and abdomen. So when they do exercise, they are usually having the hard breathing because of the fat around the chest and the abdomen. Not only that, the fat inflammatory substance that could impair lung function that can lead to the asthma for those who are obesity. And moreover, the obesity people need more oxygen when do any physical activity. So the suggestion for this physical concern and function concern, for those who are obesity, they can do brief walking, or any simple exercise to make their body keep doing any physical activity. Then they are not do any. So they can do some simple activity such as brief walking or walking. So they can do simple activities such as brief walking to make sure they keep doing any movement, any physical activity in a day. So it can be better when they do the simple exercise than not do anything. Next point, which is the last point, the pain in joint. People in obesity population are usually get the pain in their joint when they do the physical activities. This can be happen because they are accommodating excess their weight and make it as a burden for them. So for instance, I give a situation when obesity people wants to do or they do the high impact activity for a long period, they will feel the pain in their joint. So how these things can be happen? So in our joint we have a functional yellow liquid that produce joint. So in our joint we have a functional yellow liquid that produce joints to reduce the friction between cartilage and the bone. This liquid are called as synovial fluid. So if the synovial fluid is less, it makes the cartilage do not have time to recover naturally and inflammation, and makes it painful when the person are doing the movement. So it makes it harder for them to exercise and do the activity because the pain. So when this is happen for them, they will not motivated to do the exercise, and they will not enjoy to do the exercise. To overcome this problem, they can do the low impact and moderate activities to begin the exercise. For the example, the obesity people can do the burpee, the simple burpee, but not the jumping burpee. So that's all from me. Move to the next presenter. Thank you.
Hi, now I will continue the presentation about the psychological and emotional consideration. Alright, for the first point is the obese people will face the depression. Depression is one of the impacts that can be caused by the psychological and emotions. Although depression is classified as a mental illness, it is also has an impact on your physical health and also well-being. Okay, next is anxiety. Anxiety is a modest to severe feeling of disquiet, such as worry or fear. At some point in their lives, everyone suffers from anxiety. For example, that you are curious about what people think about yourself or about your appearance. After that, obese population will have low self-esteem. When someone has low self-esteem, they are unsure of who they are and what they can accomplish. They frequently feel inept, neglected, or insufficient, like they are not confident about doing an exercise given. And last but not least is eating disorder. Obese people prefer to eat, but after going on a diet, they notice that their weight has not decreased. So they figure they need to cut back on their eating even more, which leads to an eating disorder. Okay, that's all from me, and I will pass this presentation to my friend. Thank you.
And Assalamualaikum. My name is Ahmad Lina Saifuddin bin Muhammad Dinain. First of all, I would like to thank you, Nurin, for the explanation of psychological and emotion consideration. For this slide, I will share to all of you about the FIT principle for obesity. Before that, some of you might not know about the definition of FIT. FIT is the acronym for frequency, intensity, time, and type. This principle can be applied to any kind of resistance training. For example, it can be used for flexibility, anaerobic, power training, and many more trainings. First is the frequency. Frequency is about on how often you should exercise. It usually measures by number of days on each week. For obesity people, it is suitable for them to do exercise for 3 to 5 days per week because they should not push themselves by doing the exercise every day. The effect is it will cause severe exhaustion on them. The minimum days for them to do the exercise is 3 because they need to maximize the caloric expenditure. What is caloric expenditure? Caloric expenditure is the number of kilocalories that is being used during an activity during a specific length or time. It also can increase if the intensity and the duration of the activity also increase. In other words, it is to know how many muscles are being used and how hard they work. Second is intensity. Intensity is about how hard you should do the exercise. Most people tend to do the highest intensity that they can do because they want to know their limit, but it is not good for them. Moreover, if it is obesity people. For people that have obesity, they must start from low to moderate intensity. In a certain time, they can gradually progress in several weeks or months to more advanced exercise. It depends on the person whether he or she want to advance or not, because some individual may prefer doing a harder and vigorous exercise, as it takes less exercise. Vigorous exercise probably not suitable and appropriate for people that have severe obesity. If they still want to add vigorous exercise to their training, they must first wait for a few months for them to adapt with the exercise and do consult with their trainer to avoid any injury. Next is time. Time is also important because it decides on how long the exercise should be. There are certain people that feel extra motivated or more energetic when they do exercise. It is advised for them not to overdo themselves, especially for the obesity people. If they push themselves too far or exercise too long, the worst case is they can collapse due to not enough oxygen to enter their brain. They do not have enough time to take a rest. So for people that is overweight or obese, they should be doing the exercise for 30 minutes to 60 minutes. After they lost some weight, they should continue doing the exercise to avoid regaining weight instead of take a rest. Lastly is type. They need to know what type of exercise is the most suitable for them because people that have obesity do not have the same physical body like normal people. In general, there are two types of exercise for muscles, which is compound exercise and isolation exercise, and the two of them is different. To put it simple, compound exercise are exercise that use more than one muscles and are the most effective for people that want to lose some weight. For example, is lunge and squat. In the other hand, isolation exercise use only one muscle group to perform the exercise, such as a biceps curl, and it is not suitable for losing weight. But for severe cases, they just can go for a walk at a park for 30 to 60 minutes. That's all from me. Next, I will pass the slide to Ashikin to explain about the 3 weeks training program.
Assalamualaikum and good evening to my lecturer, Madam Maisara Saleh, and to all my friends. Today, I would like to present about our training program for obesity population. The objective is weight loss in obesity population and indirectly can prevent from get any disease. For this training program, we have 3 weeks. In 3 weeks, we focus to flexibility, endurance, strength, speed, and not forget to agility. For your information, we provide 2-day rest in per week. So, okay, for the first week, I will start with day 1, which is 10-minute warm-up static. Then, the exercise is body rotation, torso rotation, lateral raise, side bend, and last is standing crunch. We do in 3 sets, 8 repetition in low intensity. The duration for all exercise is 1 hour and 1 minute rest per activity. We continue with last session, which is cooling down in 10 minutes. So for the day 2, warm up to 12 minutes. Do the exercise, which is sit up, modified push up, plank press back, walking lunges, and half squat with 3 sets and 10 repetitions. Use low intensity while 1 hour duration and 13-second rest per activity. Cooling down session will be in 10 minutes. So, for your information, the day 3 and day 6 is the rest day. So, I move to the day 4, which is warm up in 10 minutes again. And the exercise is dumbbell with lunges, deadlift, overhead press, chest press, bench press with 2 sets, 10 repetition in moderate intensity. The total time for all exercise is 1 hour and 1 minute rest between activity. Continue with cooling down, 10 minutes. Day 5, we do swimming exercise. It's because we want our client not boring with our training program. As well, begin with warm up 10 minutes, and the exercise for swimming are flutter kick with kickboard, freestyle, and TikTok in 3 sets and 3 repetitions with high intensity. The duration of exercise will be 1 hour, and don't forget to cooling down in 10 minutes. For the day 7, we warm up 10 minutes again and do the all exercise, which is lateral raise, side bend, high knee jack, walking lunges, and plank press back in 3 sets, 12 repetition with moderate intensity. The duration will be 1 hour and 1 minute rest between activity. The cooling down in 10 minutes. So we done for week 1. So we go to the week 2. In week 2, same with week 1, which is warm up and cooling down session with their time. So I will tell you the list of exercise in week 2. For day 1, we provide lateral arm circle, lateral step, handstand, wall push-up, and lastly static lunges with 3 set 8 repetition with low intensity, and the time to the all exercise is 1 hours and 1 minute rest per activity. Okay, for the next day 2, the exercise is burpee, knee push up, leg extension, plank, and last wall sit up. Do this exercise with 3 set and 10 repetition with low intensity, and keep going to 1 hour 13 second rest per activity. So for the day 4, we do the exercise is jump squat, knee lift with ball, split squat stand, side leg lift, and burpee. The frequency is 2 set 10 repetition with moderate intensity in 1 hour's duration, and 1 minute rest between activity. For the day 5, we provide endurance training, which is cycling outdoor in 2 hours with high intensity. Last day for week 2, the exercise is lateral circle, arm circle, punch bright, heel touch, and reverse march with 3 set 12 repetition, and the intensity is moderate. Duration also in 1 hour with 1 minute rest per activity. So the last week is week 3. Week 3 also same with week 1 and week 2. So I will share with you guys the list exercise for week 3. For the day 1, we have exercise arm crossover, windmill, hips reel, bilateral row, inchworm, do each worm. Do in 3 sets, 8 exercise with low intensity. The duration is 1 hour, 1 minute rest per activity. Same. The day 2, we have plank reach, modified push up. We curve, plank star, and donkey kick. The exercise in 3 set 10 repetition with low intensity on 1 hour duration at rest in 13 seconds per activity. For the day 4, we provide exercise like side lunges with torso rotation, bird dot, side plank, sitting punch, pulls up with 10 set, 2 set 10 repetition in moderate intensity, and also 1 hour duration. The day 5, the exercise is wiper, LC, crunch kick, and hollow hold in 3 set 10 repetition with high intensity. The duration will be 1 hour. And last but not least, for the last day in week 3, we plan to run, which is slow jog in 60 minutes. The 60 minutes. That's all for our training program for obesity population. Thank you.
Okay, for the last slide of this presentation, which is a conclusion. So from our presentation, what we can conclude is obesity is one of the risk factors associated with the cardiovascular disease. As a result, the most crucial things to do is exercise. Hopefully, after participating in this activity, you will be better aware of the consequences of obesity, because mostly people will ask the obesity population to having a good diet plan or a good diet intake to make them more healthier in a diet part. But the most important thing other than having a good diet plan is do exercise and physical activity to make them to stay healthy and can decrease their risk of having a cardiovascular disease. So that's all from our group. I hope you guys understand with our presentation. Thank you for watching and Assalamualaikum.